welcome everyone. Gosh, after the year we've had, it is just so lovely to have you all here with us tonight to see old friends and welcome new friends. And I think the weather gods tonight are smiling on us, so hopefully that's a really good sign for the year ahead. We've got two very special announcements tonight. The first is that we have a new name. We are now officially the Bowral District Children's Foundation, or BDCF. Our second exciting announcement is our partnership with Reframe. We, the Children's Foundation, will be funding a new position at Reframe. The new position is called the Mental Health Wellbeing Ambassador. This position will be filled by Alice Richards. Alice already does a wonderful job working with young people at Reframe, and this position, which is 8 hours a week, will enable Alice to go out into the community and work with young people in schools, to work with families, to work with local services, and generally the community to help with the mental health of young people. Alice is doing a wonderful job, and we're very excited to be undertaking this partnership with her. So Alice is now going to tell you a little bit more about the position. So if you could please welcome our Mental Health Wellbeing Ambassador, Alice.
Hello, thank you so much for having us. I'm joined by some colleagues over here. I have Martin, who's our clinical director, and Luke, who's one of the clinical psychologists who works with Reframe. So I very much speak on behalf of the service. And I'd like to first just say how incredibly grateful we are for all of your support in enabling us to have this fantastic and exciting new role. This role is quite exciting for us and exciting for people in our industry if you hear about it, because it's actually quite innovative and groundbreaking. The work that we do, that we've done at Reframe, which is our local youth mental health service. I'm not sure if you're all familiar with Reframe, so I'll start with a little bit. You've probably all heard of Headspace.
Yes.
Headspace is a big national model of mild to moderate mental health support for our young people, aged 12 to 25. Down here in the Highlands, we have used Headspace funding to come up with a regional model that's specific for the needs of Winji, Caribbean, Wollondilly. So Reframe is our service down here. So Reframe provides holistic mental health and wellbeing support to young people 12 to 25. We've been doing that now down here for about 4 years. A lot of people are very surprised to hear that the Southern Highlands is overrepresented in presentations to hospital for mental health, for suicide and for self-harm. In fact, the highest out of all of southwestern Sydney. Which is a big surprise to local people when they hear that. Young people down here are very isolated. Those two shires that I mentioned that we support, so Wollondilly and Winji Caribbean down here, are huge geographical areas. So there's a lot of isolation. Kids, young people on farms with very little public transport, very little to do. So there's a lot of distress down here as a result of that isolation. Reframe has been down here working hard with a very systemic lens. People often ask me, we've heard of Headspace, we don't know much about Reframe, what's the difference? And I think our systemic, holistic lens is really very different. Luke, who I work with, was just explaining to someone that he came from Headspace, and it's a very cookie-cutter approach at Headspace, where they roll in a Headspace and they put it in a town, and they hope that the town will come along and join the Headspace kind of model. Whereas what happened here is Martin, who's incredible and paved the way before us for this service, developed a model based on the needs of young people down here in our area. So he started talking to young people and was supporting them with other mental health services through community links wellbeing, and saw the need that we have down here and saw the overwhelming isolation that I spoke of earlier. And so Reframe is all about relationships and connections and connecting young people in. Mental health, everybody has mental health. There's huge stigma down here as well in the Southern Highlands, a lack of awareness about what mental health is, and stigma about someone who has a mental health condition. But actually we all have mental health. If you have a head, you have mental health. Mental health and well-being are something that we all have. So for us it's about normalising that. So every young person that lives in the Southern Highlands is a reframer. And Reframe is there for young people to connect with each other and with us, and to have access to healthcare, wellness, and the language of well-being, which is what we really try to foster. Because we're passionate people that very much care about our whole community, we have extended that. So Community Links Wellbeing, who deliver Reframe, have a number of other mental health programs as well. So I work for Reframe, but also for You in Mind, which is our adult program. And also we have a new clinical psychology program for anyone 5 and up, which is all free and bulk billed for local families. So everything we do is for families. You cannot take a child out of the context of their family. So when we support a person, we support their whole family, and we do that by encouraging community, which is why this connection, I think, has been so profound, and why we've come together as like minds. It's the age-old proverb, isn't it? It takes a village, but it really does. And so you cannot just bring a young person into a room and do some therapy and send them out in the world and expect everything will, be fixed and fine. And that's actually not what therapy does. Therapy doesn't fix things, because there's nothing wrong with any of us. It's what's happening to us. So we sit with people, we make space for people to understand what's happening to them, what's going on for them, and to make sense of their own experience and the experience of the other, which in this case is our family or our school or our community. What we've been doing at Reframe is completely in line with policy and evidence-based, but it's also about people, local people who are really committed. So our children are in the schools here, and our families are in the workplaces here, and we care because it's in our homes and it's who we are. None of us kind of fly in from Sydney like a lot of the services that came before us, who kind of sent someone down for a day to kind of come into a school and talk a little bit, and then they went back home. We're in the schools every day, and we're out in people's homes. So Reframe provides transport for young people. We can do home visits, we can do school visits. We can connect young people with GPs, with psychiatrists, and we also provide free counselling for young people as well. So when I started at Reframe, I started as a student, and I fell in love with the model and the people who worked there, and I saw the passion and commitment, and I just never left. And eventually they gave me a job there because they realised I wasn't going anywhere. And slowly I've become more and more involved in lots of different things, which is an absolute privilege. And it's not about us, it's about the young people, and it's about all of us, actually, because we're all in this together. And so part of my role is a clinical role, so I see people one-on-one for counselling. And I work with families and I work with schools. But also I do a lot of work in the community, because one thing that's really been noticed across the board in our community is that there's these amazing services doing amazing things. There's amazing groups of people, but it's very hard for them to all connect. So we often don't even hear about opportunities that are happening in the community, or we don't know about services that are just down the road, or we don't know about amazing charities or organisations that are doing things. And that's really what Community Links Wellbeing, who started over 30 years ago, are all about. So how do we get wellbeing? Well, we link the community. So it's always been a passion of ours to connect silos in the community and bring everybody into the room, because we're all in this together. Reframe is funded by the Federal Health Department, so our mental health programs, all of the mental health programs that Community Links do, are funded by the Primary Health Network, so the federal government. And that funding is very specific about what we can do, but we have been so fortunate to have an organisation, Community Links, who support us working in a flexible way, and the PHN who fund us have been incredibly generous to support our flexible model as well. So we're able to do things and think outside the grey and work within a lot of flexible services. So we've always wanted to provide easy access to young people and get out to as many young people as we can. And so even though our funding is for individual therapy, not for groups and not specifically for community work, we've been able to do a little bit of that. There was a recent children's wellbeing and mental health strategy, a national strategy that came out in October, and it had a number of priority areas. And all of those priority areas are along a similar theme, really. It's all about equity and access. It's all about early intervention with children. Half of the children diagnosed with a mental illness are not receiving any support at all in Australia. So there's nothing but need nationally, also locally, there's nothing but need. And what the policy and the strategy is saying is in the future we need to be more flexible, we need to be more equitable, more accessible. We need a universal system. We need to connect, essentially. Bronnie Taylor, who's the New South Wales Minister for Mental Health, came down to Reframe recently and was talking all about how her vision for the future is of community-based non-clinical supports to work hand in hand with clinical work. And that's all through the policy and all through the strategy for the future. But it's been a vision up until now. Unfortunately, it's been our vision, but our funding hasn't afforded that for us. And with this position, you have all given our community that opportunity. So in my role, I will be spending half my time doing that clinical individual work with young people and families, and the other half of my time will be doing exactly that. So community work, community non-clinical support, but actually everything's therapy. Everything we do is to connect people to our service and other services and to help people connect to each other, which is how we get rid of that problem of isolation. So I'd like to thank you all for the opportunity that you've given our service. Hopefully you can see how excited we are about this opportunity, because it really is ahead of the funding, which is what BDCU previously and now BDCF have done so well. So you have a wonderful model yourselves, where you come in and you fund a position for a short period of time until people realise they can't live without it. So you will see me in your primary schools talking to young children, telling them about all the services and supports, but also just giving them the language of well-being, helping them articulate their experience. It's okay to be sad, it's okay to be worried, but if we talk about it, we can figure out why, and then we can do something to make that just a little bit better. You know, sometimes we can't fix things, but with each other, we can make things a little bit better. I'll continue to be in high schools, which is fantastic, linking high schools, linking community. I have a bit of a role in the media and in the newspaper and on radio and things like that. So again, out in the community, as an ambassador, providing this language to our whole community, so it can filter not just from the 4-year-olds in preschool, but to all of us that are in this together. So from the bottom of my heart, on behalf of Reframe, we all thank you for your support. Your support of our service and the work that we're doing means so much to us. And I'd also like to just assure you of our commitment. The team that I work with are all local people who really care about what they're doing, and I've never seen more committed people who work for the reasons that we're all in this, for the values and for the children and the families here. So thank you, and thank you very much for having us tonight.
Thank you, Alice, so much for explaining to us all about what Reframe is all about, and also about what you will be doing in the role you already do and in your future role. We're really looking forward to our partnership with you and with Reframe.